Folks, it is World Sickle Cell Awareness Day. It primarily affects African Americans. 1 in 3 African American babies, they are born with the sickle cell trait, while 1 in every 365 black children born with sickle cell disease. St. Jude Children's Research Hospital in Memphis has been at the forefront of finding a cure for sickle cell disease. I recently spoke with Richard Shadyac, of course, the president and CEO of the fundraising arm for St. Jude.
Most people think of St. Jude Children's Research Hospital and they immediately think of childhood cancer. Well, the fact is the very first grant that St. Jude Children's Research Hospital ever received was for sickle cell disease. So we've been involved with sickle cell disease even before St. Jude Children's Research Hospital officially opened in 1962. We've continued to research that disease today, and we have one of the largest sickle cell programs for kids in America.
And I know the Children's Hospital in Philadelphia, they've been also involved in trying to do some research on this as well, trying to find a cure. And for the longest, I mean, as a kid, when they had, it used to have a national telethon for sickle cell. And my parents, my brothers and sisters and I, we raised money for that. So I've been very well aware of sickle cell. And it's one of those things that for a lot of people, they just don't know about and doesn't get lots of attention, especially from funders and other researchers.
Yeah, no, that's exactly right. I mean, it is predominantly in the African American community. It's a shame that people don't talk about it. We talk about it all the time here at St. Jude Children's Research Hospital. And you know, St. Jude Children's Research Hospital was the first institution that found a cure for sickle cell disease by using a bone marrow transplant. It was almost coincidence because it happened while we were treating a childhood cancer patient, and that child ultimately recovered not only from the cancer but also from sickle cell disease by using a bone marrow transplant.
So what are you now doing around World Sickle Cell Day?
Well, World Sickle Cell Day is a day to create awareness around the globe about this disease. And you know, here at St. Jude Children's Research Hospital, we want the world to know that this continues to ravage the African American community. We also are starting a couple of different initiatives. So first of all, we were able to prove here that a drug that was used with adults, hydroxyurea, was okay to use on kids. And this has helped our kids battle sickle cell disease exponentially. But what we also now want to do is we want to expand our study. So you all know that right now we are the national institution that focuses on childhood cancer survivors. We want to do the exact same thing for sickle cell disease. We want to understand why the average life expectancy for an adult with sickle cell is shy of 50 years of age, okay? We know these kids do very, very well. So what we want to do is follow them not only through their childhood but into adulthood and try to understand what's causing kids that become adults to ultimately not fare well in adulthood. This is very similar to what we've done with our pediatric cancer survivor program. So we're hoping and praying that we're going to learn more about, you know, whether it's just not getting follow-up care or what the cause is, and then eradicate that and make African Americans and anybody afflicted with sickle cell disease live out a full lifespan.
Go to our panel here. This, you know, is it very interesting when you talk about sickle cell does not get significant attention whatsoever. As Richard Shadyac said, you know, the amount of research, I mean, not even close. And it's a disease that, frankly, a lot of African Americans should be pushing more. There used to be, as I said in my interview with him, there used to be a national telethon. Yeah. And as a kid in the 70s and 80s, we were involved with it.
Yeah. I mean, it's sad because it's one of those things where, except for St. Jude's, I don't really know anyone that's paying significant attention.
Children's Hospital in Philadelphia.
Philly.
They have a doctor there who's also found a cure. They're trying to raise additional funds for that to be actually tested even more so.
You know, this is one of those issues where you know, we as a community could do a lot of good, coming together and actually pushing our own resources to the issue, pushing our resources to finding a cure. You know, we can't expect, you know, our diseases, you know, diseases that are specific to African Americans. I mean, you know, sickle cell, when you have something that's affecting 1 in 3 black kids, and one in, you know, I believe it was 100, you know, black kids are actually born with the actual disease. It's a black issue, and it's going to be something that requires, you know, black donors to, you know, raise black money, black dollars to conduct research to, you know, better the black community.
Real quick, Dr. Yvonne Carroll, Director of Hematology at St. Jude Children's Research Hospital. Dr. Carroll, in terms of the public, what is needed? Well, you know, what is needed? I know what St. Jude is doing, but what do you want black folks to do?
I think more awareness is always needed for the disease. It's a disease that worldwide millions of people are affected with sickle cell disease. And in the United States, only one drug, hydroxyurea, is FDA approved for the disease. And we at St. Jude are trying, that drug is only approved in adults. So we're working really hard to pioneer and get it FDA approved in children and doing research, the studies that need to be done. But everybody needs to be aware that this is a disease that has got to come to the forefront. We have to have more awareness. And I think 20 years ago, we had more awareness, but once we had newborn screening and it was diagnosed in birth, then people became complacent. And I think we need more research. We're working really hard at St. Jude. We have several labs that are doing research. We have clinical research, but the community as a whole needs to come out and make sure that everybody is aware of this disease and money is directed at this disease the same way as it is directed at other diseases in this country.
All right, Dr. Kell, we appreciate that. We're out of time. We have some technical issues there, but we thank you for joining us.
A peaceful protest turned deadly. 37-year-old black man was shot and killed by Baton Rouge police. His hands are in the air, and you still get shot by the cops.
Oh my God, please don't tell me he's dead.
We're not going to let hate define us.
Race is a big part of this.
If truly all lives matter, then all lives need to matter equally.
What we require is action. What we require is accountability. We understand that black lives do matter, and we will keep focused on this issue.
NewsOne Now, every weekday morning at 7 on TV1.